Tucson Medical Center's pre-catheterization area is where patients are prepped for their cath lab procedure. Please check in with the nurse when you arrive. You'll be taken to your partitioned room where one family member may join you. Others are asked to stay in the waiting room located inside the pre-cath area. Your nurse will perform an EKG, do any necessary blood work, start an IV, and go over your procedure. There are plenty of opportunities to ask questions.
What exactly is going to happen to me?
Patient Gary Brockla gives his perspective.
And you're kind of scared, and so your mind is fluttering all over. You don't know what's going in. But though they did come in, they put me to ease. They kind of told me what was going to happen as it was happening, so that I kind of was understanding and kind of calmed down that it was going to be okay. You know, you've got a bunch of professional people. They know their job and they do their job very well. And you're the most important thing to them, but everything is done in a professional way and that the patient comes first.
Brockla remembers being really chilly.
It seems like when you come into a hospital setting like this, it's always cold. And the staff was always
You'll feel much better.
very present of the fact that if you got cold that they would bring you more blankets.
If your doctor has ordered an angiogram, a procedure to get images of your heart, you will need to have a spaghetti-like catheter inserted that goes up to your heart. Your physician will determine the best place to insert it. It may be your wrist, but for most patients, the groin is used.
The nurse came in and got me prepped for the going into my groin, and so she had to shave me, which is kind of a scary thing because I'm not used to having somebody else down there working on me. But though it was all done very professionally.
Pacemaker patients do not need to have a catheter inserted. When you are all ready, you will be transported to the cath lab, about a 2-minute walk. Your family members may accompany you. That journey, Brockla says, is surreal.
It's not something that would be normal to a normal person to get wheeled down the hall on a hospital bed in a hospital going to get an operation or a procedure done. So it's a very unnerving time of your life. You're kind of scared.
As you are wheeled inside the cath lab, we ask that all family members stay in the Rosenstiel lobby. A TMC volunteer is available during business hours to answer any questions your family may have and provide them with a paper that includes your unique identifying number. They can then track your progress by checking the patient number listed on the monitor in the lobby. Restrooms are conveniently located near the Rosenstiel lobby. The cafeteria is also nearby. Head down the Hall of Giving, then turn right onto Booth Hallway. The cafeteria will be on your left. Inside the cath lab, patients wait for a bit before being wheeled into their procedure room. Again, Brockla remembers being cold. That's because the equipment needs to be kept at a certain temperature.
It's really cold in there, and when I first got in there, and so I mentioned something to the nurse, and immediately she brought warm blankets.
You will be wheeled into the appropriate room for your procedure and moved onto the table. After you are prepped, a large imaging device will rotate around you close to your body.
My fears were eased quite a bit by the staff, and they were telling me what was going to happen. And
you will be given some calming medicine by your nurse and then undergo your procedure. If you're getting a pacemaker put in, a small incision will be made, typically in the upper left part of your chest above your heart. When your procedure is over, you'll be wheeled to the Special Procedure Cath Lab Outpatient Recovery Area, also known as SCORE. Along the way, your physician will check in with your family. We ask that only one person then accompany you back to the recovery area, please.
The next thing I knew, I was woken up in the recovery room. The staff would come and check on you periodically to make sure everything was okay. But you're in a room where they could see you the whole time. And they still had me all hooked up to all the equipment.
TMC staff will do everything they can to make you as comfortable as possible during your stay here, which can range from 1 to 4 hours.
The one thing that they were very strict about was that because of the way where they went in through the groin, that I had to remain absolutely still for, I believe it was 3 or 4 hours at the time. I just kind of laid there, and I think I kind of napped on and off, after the procedure. I was kind of groggy, and so I don't really remember a lot about it. I just remember I did have an apple and I had some juice. And
Pacemaker patients can sit up shortly after entering recovery. You will then return to the inpatient cardiac unit, head to the post-cath observation area, or be discharged home. Please ask for directions on how to get back to the northeast entrance from where you are.
The one thing I've learned is that a happy patient is the goal of the whole hospital, and they want the hospital is really concerned that they want the patient, when they leave, to be able to recommend TMC to other patients.